Hello everyone, today we are going to discuss a case study about urea cycle disorders. We have prepared a case that will help to improve your learning and enable you for better diagnosis and its management. We will discuss case study, biochemical defects, pathophysiology, clinical manifestations, treatment, and notes. Without further delay, let's begin with our case. A 5-day-old male is brought to the emergency room by his parents. They report that their child just suffered a seizure and has been feeding poorly since he was released from the hospital just 3 days ago. On physical exam, the infant appears lethargic and has evidence of hypotonia, when serum laboratory studies reveal the presence of elevated levels of ammonia. So, what do you conclude from this case? Still not clear? Don't worry, let's go a bit deep and try to understand it better. Do you remember the urea cycle? Try to recall it. This is the urea cycle. Let's understand its pathophysiology. So, ornithine transcarbamylase is responsible for combining ornithine and carbamoyl phosphate to form citrulline. In next step, arginine is produced, then arginine, and after that urea is produced, which is final step. When this enzyme is deficient, the urea cycle is unable to convert excess nitrogen into urea, thereby leading to high levels of ammonia or ammonium ion. Levels of carbamoyl phosphate are increased and are shuttled into the pyrimidine synthesis pathway, which results in increased orotic acid levels. That's why lab findings shows increased levels of orotic acid levels in the blood and urine. Moving to its clinical manifestations, as we have already discussed that increased levels of orotic acid is due to ammonia or hyperammonemia. Hyperammonemia can lead to seizures, coma, and even death, while other clinical manifestations are usually present within first week of life with lethargy, vomiting, and decreased feeding. How this patient should be treated? In patient keep low level of nitrogen, because we have already discussed in pathophysiology that when ornithine carbamoyl transferase enzyme is deficient, the urea cycle is unable to convert excess nitrogen into urea, thereby leading to high levels of ammonia or ammonium ion. So, in patient keep low level of nitrogen, either through diet, as patient should be given low nitrogen diet, or through drugs to remove excess nitrogen such as sodium phenylacetate, and liver transplant, as we have already discussed in our video on urea cycle, that urea cycle occurs in liver. There are many other disorders related to urea cycle, but ornithine transcarbamylase deficiency is the most common urea cycle disorder. That was all about today's video on one of the most common disorder of urea cycle. Stay tuned to sqadia.com for more precise and knowledge stuff videos.